The biggest misconception is, what is an organ? Each tooth is an organ. If we can believe that, then if it's dead, why are we keeping it there?
There are physicians out there that have said, I have never had a patient come in with any form of cancer that did not have severe dental decay.
The biggest thing is patients are suffering from chronic issues. When I see the x-ray, I don't even need the medical history because I can just look at each tooth and know what's going on there. Patients are coming in sick, and these patients want to be better, but they're not getting the right care.
Chronic infection causes immunofatigue, the progressive, slow overwhelm of the immune system.
One of the things I've noticed on every patient who goes through this treatment, taking out the stuff that shouldn't be there, their eyes lighten up. Brain fog gone, psychosis gone. It's insane.
What else does my audience need to know about biologic dentistry, or what symptom might they be having right now that they can't put a finger on?
One of the biggest problems with that is I'm like the 30th person they see. They've been around everywhere. They spent so much money on their healthcare. And the major thing in biological dentistry is
Hey guys, welcome back to the Ultimate Human Podcast. I'm your host, human biologist Gary Brecka, where we go down the road of everything anti-aging, biohacking, longevity, and everything in between. And I'm so excited to welcome back a very close friend of mine who's become a close personal friend of my family, my kids. He's done so much for my family and I. He's given me teeth, my wife, my daughter, my doctor. Just about everybody in my life has gotten a tooth from this dentist. He's one of the best biologic dentists in the world. He's taught me so much about the importance of the oral cavity. If you haven't seen the first podcast that I did with Dr. Jigar Gandhi, you've got to go watch that podcast. Biologic dentistry is now just hitting the mainstream. We just launched our short on oral health and oral health care and biologic dentistry, and it trended so fast that I said, we got to bring Dr. Gandhi back on to answer some of the questions from you guys and really take a deep dive into biological dentistry. So Dr. Gandhi, welcome back to the Ultimate Human Podcast.
Thanks for having me.
Last time we shot it in your living room.
Yeah, we did.
Because I was actually up there to have a surgical procedure done.
Yes.
I think when we did the last one, this tooth you had taken out and had the post, so you put this post in, and this tooth had come out, so you put this post in. So
we still got to get you a tooth.
I still need a tooth over there, dude.
It's coming soon.
Yeah, I'm not airing the podcast till I get the tooth. It's going to be like a little quid pro quo. Dude. I'm like,
fair trade.
You want me to release the podcast? I need a tooth. But he's done this for my wife. He's done it for my daughter. He's done it for Dr. Sardo, who's been our clinic director for years. And you know what's crazy is that from that first moment that you and I had a friendship for a long time before you ever actually did any work on me. And, we were clients of each other's. We met through the 10X health system. And I remember the day that I cracked my tooth and I called you, and you identified all of the problems that I was having associated with that tooth, which I had never connected to that tooth. Yeah. I had left anterior shoulder pain. I had a catch in my left lower lobe of my lung, which I just thought was a runner's cramp, from exercise. And then I had this strange thing where once in a while, my left toe, of all things, would either itch or it would go numb. And sometimes I would tap my foot on the ground, and Sage used to make fun of me because I would take my shoe off and I would just itch my big toe and I would put my shoe back on. And I never connected that 19th tooth meridian to the symptoms that I was having. And 48 hours after you took that tooth out, the symptoms went away. And I think the thing that hit me the hardest was being woke to biohacking, or whatever you want to call it. I do the red light. I do the sauna. I eat whole foods. I focus on sleep. I get in the sauna. I'm really trying to do the best with the tools that I'm given. And I was completely oblivious to biologic dentistry, even though we were friends, and the impact that it could have on people's health. And now, maybe because I started really digging into it, I get things through my feed all the time. And the claims range from it has no impact at all, leaving dead tissue in the body doesn't harm you, to there are physicians out there that have said, I have never had a patient come in with any form of cancer that did not have a root canal or did not have severe dental decay. And when you start to look at the maps of the nerves and the blood supply and the proximity to the brain and the drainage into the heart, it really starts to make sense. That as these signals are transgressing the body and passing through the oral cavity and back up through the oral cavity, and that decay and parasites and bacteria and viruses that are here, in your mouth, they're easy gateways into the body.
Yeah, correct. Because the biggest misconception is what is an organ, right? When we think about it, Dorland's Medical Dictionary will define an organ as something that has a nerve, which is a trigeminal nerve that innervates the teeth.
Here.
Then you got the blood supply. Then you also have the lymphatic drainage, which we neglect a lot in modern medicine, like lymphatic drainage. Oh, it's just lymph. No, the lymph is the pathway where everything's going to start spreading. And then the function, mastication, right? You're chewing with the teeth. So each tooth is an organ. If we can believe that and go by that, then if it's dead, why are we keeping it there? Or if it's infected, why are we keeping it there? Right? Is it okay? Well, if you want something dead in your mouth, then keep it, right? It's up to the patient, but education is number one. And that's what I'm seeing the most now. Patients are coming in, they're self-educating themselves, which is what we want, right? That's what you do really well, is you're educating people, and then they're learning about it more and more.
Yeah.
So they're going to the doctors and figuring it out, like, no, this is the problem. This is what's causing me or holding me back.
Yeah. Yeah. Since my journey with you, I've referred you some of the most famous and impactful people in the world. I won't mention their names. They may or may not go public with their story, but I have yet to hear anything other than just astounding stories of, we have a mutual friend from Atlanta.
Yes.
That recently came to see you. And I won't say his name, but his blood work indicated that he had an autoimmune disease.
Correct, yes.
And so I called you up and I said, I'm going to make this introduction, because during my discussion with him, I said, have you ever had a root canal? And he's like, I've had 4. Have you ever had wisdom teeth? Yeah, 4. Do you have other dental work? And he just talked about bridges and caps and root canals. And so his mouth was a minefield. I just knew it. And I referred him to you. And even though he was in a lot of pain and recovering very well, I talked to him 48 hours after your procedure. I think he still might have been in New York at the time. And he did not have enough good things to say about you, man. Yeah. I mean, he was just raving about, for him, it was the instant relief from his low back pain.
That's the number one thing that he said to me.
Yeah.
It went away.
Yeah. He's like, and he said, I'm not going to mimic his voice because you'll know who it is. I almost did my impression of who he is. But he called me up and he was like, Gary, I'm not kidding you, man. I am not shitting you. This is not placebo. My back pain is gone, and I've had it for years. It is gone. And this has been months now. And I talked to him about 4 days ago, and he said, it hasn't been back.
Yeah.
And so nothing else changed other than he got this procedure done. So if someone is new to biological dentistry, if someone is new to the concept of root canals and cavitations, which are these pockets of infection in the jaw that not all dentists are trained to see.
Correct.
Right? You need a special type of x-ray called a cone beam x-ray. If someone's new to this and wonders if it might be something they should look at to address symptoms they have, what's kind of the myriad, what's the world that these symptoms live in if there's issues in the oral cavity?
Just having a cone beam is one thing, and it depends on who's looking at the x-ray, right? Because biological dentistry and holistic dentistry now is being thrown around. Like it's like real estate agents or day traders. Like everyone's doing it, right? Everyone's
real estate agents
and that's the problem that we're facing, because I see a lot of referrals or second opinions from patients who've visited biological dentists. So it depends on the training, and we're working on it. Like you did a podcast with my buddy, Dr. Dom.
Oh, I love him.
Yeah, he's awesome. And
he's like the Godfather, right?
Yeah,
I mean, he's really.
And we're working on trying to get the word out there, like well-trained biological dentists, not just with biological dentists, because now you do got to put that word just, because that's the biggest problem that we're facing now. It's just everyone wants to advertise biological dentistry.
Right.
So the biggest thing is patients are suffering from chronic issues, right? And what we're looking for is, like, I'm a dentist. I'm not a medical doctor, so leave the medical profession out of this. But when I see the x-ray, I don't even need the medical history because I can just look at each tooth and know what's going on there by looking at the meridian chart as a reference tool. And patients are coming in sick, and these patients want to be better, but they're not getting the right care, right? So the biggest thing we're looking for is if there's metals in the mouth, whether it's titanium, mercury fillings, mercury crown, metal crowns, any teeth that were taken out that weren't clean, like our friend who came in to visit us, he had teeth that were taken out, but they were infected in there, in the jawbone.
Wow.
But he was told that
And they
everything was
stitched
fine.
this shut, and because there's no tooth, and maybe even the nerve is dead and the blood supply has been reduced or even eliminated, that's the thing that's important for people to understand. There's no pain associated with this.
Correct. It's chronic.
And it's not like you're stuffy and sneezy and your chest is congested and you have pain in your jaw or you have a lot of phlegm or mucus or things like that. The normal things that would drive you to seek some attention.
Yes.
Those are not there. And I think a lot of times because those symptoms aren't there, we think nothing is wrong because we associate an infection with pain, redness, numbness, swelling, some kind of dysfunction. But what are the most common symptoms? And I know there's just an endless myriad of symptoms, but I would say if you were lumping your patients into major categories, what are most of the symptoms that they're coming to you with? Do they have autoimmune? Do they have cardiac issues? Do they have pain somewhere along the meridian chart?
Yeah, so autoimmune's big, and cardiac issues, and chronic inflammation. So, and it's hard to determine where it's coming from, like elevated red blood, elevated interleukin 1 and 6, elevated ESRs. So they're coming in with a gambit of diseases.
Yeah.
Right?
So these erythrocyte sedimentation rates and these interleukins that he's referring to are different cytokines, different inflammatory compounds that are secreted from white blood cells and in the body in response to an infection or the presence of a parasite or a virus or another pathogen. Just wanted them to know that. So general inflammatory markers would be things like C-reactive protein or homocysteine, other things. So you're saying that they'll have these inflammatory markers in their blood work.
Correct.
Maybe they've been diagnosed with an autoimmune disease out of the blue.
Yes.
No family history, no real trigger that they can point to. And chronic infection causes immunofatigue. And we know now that one of the big emerging theories in aging and longevity is this whole concept of immunofatigue, like the progressive, slow overwhelm of the immune system. Yeah. It's like putting a pound in your backpack every day until eventually you have so many pounds back there you just can't, right? And then the immune system essentially collapse, and then bang, the fire starts. And this is no doubt a part of that sequence of stressors that the immune system has to deal with that eventually cause it to cave.
I mean, when you look at chronic fatigue syndrome, it's huge, right? Look at what happened with your wife. Right?
Yeah.
She had the cavitations, but it didn't know why. She's always waking up late, and now she's up early. Right?
Yeah.
All of a sudden.
Absolutely
right?
true.
What changed for her? She
Sleep
was
improved.
doing the same protocols that you put her on, but it didn't work.
Yeah, you ruined my Good Morning Babe series because it was
good.
the most popular series on Instagram, and you screwed it all up because I wake up in the morning on fire, and she slept in, and it used to let me go get a workout and get a breath work and sunlight. Then I would come barreling in the room and wake her up, and I got so much joy out of that.
Yeah.
But
and that's what happens when the tooth is taken out. Like when you talked about, the tissue closes. So when you take a look inside the mouth, the tissue looks beautiful. It's nice pink. But what's underneath there? And when the ligament is left behind, what we call the periodontal ligament, that causes the root of all evil. It just becomes a swamp of pathogens in there. And it could be any type of pathogens. It doesn't have to necessarily be only bacteria. Because as a dentist, we're trained on bacteria, fight the bacteria. But what about the fungus? What about the parasites? What about the viruses?
Yeah, I saw the spirochetes in my blood because one of the things that we did, and if you haven't seen our first podcast, you should really go back and watch it. And right around that time, I did a post on Instagram. If you scroll down, it's probably still on there, where we took it and we went back and we put it on a slide and looked at it under a microscope in your office. What was astounding to me was we burst that little sack and we sort of smeared it on a slide, so gross, and looked at it, and you could see the little spirochete parasites, these little helminths, and excuse me, you could see my white blood cells, my macrophages kind of going after it like little Pac-Men, which when I looked at that activity and I saw it with my own eyes, and we took that from the bottom of the tooth that you removed, I was not only convinced, I was committed to getting your message out. And that's why I also interviewed Dom and really just trying to spread the word of biologic dentistry, because I think pain and symptomology is what drives people to seek attention. And unfortunately, this has symptoms, but they're not the symptoms that you link back to the oral cavity. There are symptoms of other kinds of chronic disease, autoimmune, cardiovascular, psychiatric, but you're not linking these back to the oral cavity because you don't have any symptoms here.
Correct. And that's where, well, first, thank you for getting the message out there. I mean, you've made a world of difference with biological dentists. Like
Awesome.
I've dentists all around the world that I'm friends with.
Really?
And by us doing that podcast, it helped get the word out there, and we're not afraid of talking about it. Because
Right.
before, the message was like, hey, don't talk about it, just do it. And
Yeah.
we've known each other for a
Yeah,
while.
sadly, because
And
it's
I was
outside
doing
the
it.
box.
Correct. And it's so hard to get that message out. But now it's like, okay, well, the science is backing us. There's nothing weird we're doing. We're just following the science. And if someone is having these issues, like you talked about psych issues, well, if you have pathogens on your trigeminal nerve, they're going to go connect to the vagus nerve down over near your neck area and then go shoot up back to your brain. So now you're in sympathetic and parasympathetic. Your body can't decide. So of course you're going to have psychosis. You're going to have all these issues. So if we can get every medical profession out there, hey, like treat the patient, but bring a Panorex, bring an x-ray, just a visualization, a 2D visualization of what you have going on. And just simplicity. You're not going to diagnose. I mean, just take a look. Oh, well, you had some dental work here. Go find the proper dentist and see if this can be correlated. And we work as a team, because that's the only way to get this out there and get optimal health for patients.
If you want protein to build lean muscle, but without the caloric impact or need to cut, you need Perfect Amino. It's pure essential amino acids, the building blocks of proteins, in a precise form and ratio that allows for near 100% utilization in building lean muscle and no caloric impact. So we build protein 6 times as much as whey, but without the excess body fat we normally get during bulking. This is the new era of protein supplementation, and it's real. If you want to build lean muscle without having to cut, you need Perfect Amino. Now let's get back to the Ultimate Human podcast.
Yeah. Now, is there any kind of repository for real biologic dentists? Is that something that you're working on, so that, obviously not everybody can fly into New York to see you. You're in Long Island, but is there a place, if I'm in Kansas or I'm in California or I'm in Texas and I watch this podcast, I'm like, man, I got to go get with a biologic dentist. Is there a registry that we can find?
There is. We'll give the link, so then everyone
So I'll link that in the show
it.
notes.
Because it's also not just a biological dentist. We want to make sure that they're fully trained.
Okay, great.
And they can follow the same protocols, like the same protocols that were used on you, used on Sage, used on even Max, everybody.
Yeah.
We can talk about this
because
they
we can
signed
talk
the
about
HIPAA form.
throw Max out there.
Them.
Max,
Yeah.
we just threw your medical information to 2 million people.
Yeah.
No, you've worked on my whole team. I mean, with incredible results. You actually owe Max a tooth too. He owes 2 people in this room too. Dude, come on, bro.
You guys are so busy. He was supposed to come Monday, but like, don't stop.
Did you bring it with you? I mean, can we pop it in on the podcast?
Here you go. Zip. Put it right in.
What was actually really cool is the last time I was in there, I was like, hey, by the way, I chipped this tooth right here, and you're like, no problem. Fix the little chip that I had in my tooth real quick, like a MacGyver. But I mean, calling attention to it is important, and I think when you went in there and removed the tooth from me last time, I was really it made perfect sense, the mechanics of what you were doing, because you ran ozone and down into my jaw. You ran red light, I even think green light, into my jaw. And then you took my blood, spun it down, and made these little slugs called PRF, platelet-rich fibrin, and packed them into the wound. So take my platelets, which, remember, platelets are these cells that carry growth factors, and they're all the healing power of the human body. And most people have heard of PRP, platelet-rich plasma. It's infamous for being injected into joints and whatnot. But when you can actually concentrate the power of the human body in one location, I was actually very surprised how well I healed, how little pain that I had. You know, I had some pain that night, which you handle with Motrin, but I didn't take pain medication after the first night. Didn't really interrupt my sleep. It interrupted my chewing for a few days. Stitches healed. It's completely was painless thereafter. But what I got out of it, the level of mental clarity and the fact that all of these symptoms, you know, almost immediately disappeared was astounding. But what I remember from the surgery is when the tooth came out, it didn't bleed much at all.
Correct. Yeah.
And my gum was very light pink and it was oxygen deprived. And you said that's a bad sign. And I remember you worked on it until we saw the bright red fresh blood, because you wanted that blood supply to return. You wanted the immune system to be able to get there. You wanted to be able to flush out the toxins. And it just made so much sense to me. I remember when I had the root canal done, it was like, wham, bam, thank you, ma'am. It was just, I mean, the waiting room was full. There was a line of treatment rooms in this dental office I went to. I won't say who it was, but a line of treatment rooms. And all these dentists did was root canals, and they were just churning people through there. And I mean, he drilled it, did the root canal, packed it, and I was out the door so fast. I almost felt like, wow, that was a really quick procedure. I wonder if he got everything. I wonder if he sanitized. I just remember I had that on my mind. And then when we looked at the cone beam x-ray, there was an air gap in there, and then the infection.
Correct.
And I think dentistry is probably the only practice of medicine that still believes you can leave dead tissue in the body.
Yeah.
Right? Cardiologist doesn't believe that. Nephrologists don't believe that.
Yeah.
You know, a colorectal surgeon would tell you, if the
Remove it,
bowel's
cut it.
necrotic, you got to take it out,
Yeah.
right?
The crazy part for that is, like, when you think of if a tooth is sensitive, right? You put a little desensitizer on there. There's 2 million tubules on a tooth or more, right, on each tooth. So whenever you do the root canal procedure, you're taking out the main nerve. So now it's dead. So all of a sudden, sensitivity goes away. But think of a tooth like a sponge. It's going to soak up all the water that you spilled. Now, when you do that procedure, do you think all the 2 million tubules are plugged? No. But they did a great service for you, because if you had severe pain or acute pain, got to get you out of pain.
Right.
So the procedure still is necessary in dentistry, but what's going to happen after the fact? We need to plan for the future to prevent any other disease from starting, right? Because there is going to be something that happens. We all start breaking down somehow.
Right.
And if we want optimal health, then, okay, well, this is a problem here. What are we going to address it now or in the future, a few years from now, whenever? But at least the patient has a game plan.
Yeah.
Right.
You know, what was really interesting is you and I geek out a lot. We text things back and forth. I mean, look at this study. Look at this study.
The photos.
Yeah. Oh, yeah. He sends me some gnarly surgical photos, which maybe I'll throw a couple of them in the show notes so you guys can, if you're as gory as I am. But they all have a happy ending. That's probably not the best.
That's not a good thing to say.
Yes, no, they all have a bright spot at the end of the story. And, where you see these mouths just wrecked and torn apart, and then this beautiful smile emerge. And, one of the articles that you sent me that I took a deep dive on was actually looking at the pathogens that are in some of these root canals, identified as the same pathogens that they're finding in a lot of cardiac pathology, right, including plaquing, scarring, narrowing, calcifications, atherosclerosis, arterial sclerosis. And when you, and then they talk about it in this study, and I'll put the link in the show notes below, because I don't want you to have to make a medical claim. But when they were mapping these pathways, directly down to the heart, and you can see that these bacteria and these pathogens have a wide open hallway to walk through. They're not even any closed doors right into cardiac pathology. And the fact that they were able to isolate the exact pathogenic species from the jaw in the heart, and as the genesis of some of these pathologies, I was like, my head was like, poof, it just exploded. And I believe that dentists like yourself, especially under this new administration, I think you're going to see a wider lane opening under MAHA for practicing this type of dental medicine, because right now, what do they call it? The standard of care or the scope of practice sometimes keeps physicians and dentists in a certain box, and there's risk in going outside of that. And I think as we drive patient awareness, which hopefully this podcast will do, hopefully we'll see those things become a little more relaxed.
I agree with you. We have a surgeon general, but we don't have a dentist general, right?
That's a good point.
There's nobody, and
hopefully it will be Casey Means here very soon.
Yeah, absolutely. Yeah, and hopefully she considers a dentist on her team as well, because without your teeth, what are you going to do? Like, how do you process foods, right? How are you going to get things into your body? Through an IV.
I'm trying to get her on the podcast on the 21st, so I'll ask her if she lands.
Yeah,
I have her brother, Callie,
100%, because it's something that we just got to work as a team.
Yeah.
Right? And if we work as a team, then we can figure out the root of disease, and chronic issues. And maybe we don't need to spend as much money on medical care.
So if somebody's had a root canal, I mean, it's possible that it's not infected, right?
Correct.
It's probably
100%. If it's done really well, 100%.
Yeah. But if you've had a root canal and you don't have any symptoms, what are some of the reasons why you should go seek a biologic dentist?
Yeah. So to trace it through the meridian chart, are they having any issues like for you? Like, okay, well, I'm not going to ask you if your toe is bothering you as a dentist, right? But if you'd let me know.
But you did, actually.
Yeah, I did.
When I took the picture of the tooth.
I knew what was going on because I saw you stomp your toe a few times before.
Yeah,
too. I'm like, what is this guy doing?
Yeah.
Why you keep stomping your toe?
Yeah, I would just tap it.
And then after that, I'm like, okay, I put it together. I'm like, hey, this is what's going on.
Dude, you asked me about left anterior shoulder pain, left lower lobe pain, and my left big toe. I mean, it was so specific. And by the time you got into the lung, I was like, you're freaking me out a little bit. When you said the toe, I really freaked out because I haven't even told Sage, that. It's not like I'm walking around going, hey, once in a while my toe itches. Yeah. It just was like a thing that wasn't one of those things that would drive you to the emergency room or make me go to the urgent care. And I always thought it was like, I just sat on my leg wrong. Yeah. And I would only get that catch when I would exercise, but it was the exact same spot on the left side every time. Yeah. So I was like, maybe that's just where I'm getting a diaphragm cramp. And then the shoulder, I was like, maybe I just have a little minor bicep issue. It's like biohacker. I'm like, I kind of know what that is. It's, that's bicep tendon. But then bang, it was gone. And when you walked in today, I said, I've got to tell you, so many of the referrals that I've sent to you have texted me, and I showed you some of the texts when you got here, have texted me with these miraculous turnarounds in things that they thought were chronic or totally unrelated. Yeah,
and no, I appreciate that because I treated hundreds of patients who come from the podcast. Even got some testimonials that they wrote. For you.
Do we have a rep share in place with him? Should we be getting? No, I'm just kidding.
It's all good.
No, I love the fact that you're doing this.
They're flying in from around the world because of this, and they can't find the right care. And going back to your story, I freak out a lot of my friends and people I'm with because they're like, "Oh, what the hell? Like, how's he know?" But all you need is a 2D X-ray, a Panorex, and just to take a look, not for any diagnosis. And then compare it to the meridian chart. In the meridian chart, we have one interactive on our website. You can just click on each tooth and it'll tell you the references of what it points to. And it's 5,000-year-old Chinese medicine, but they figured it out. So it's nothing that I'm doing that's new. They laid out the groundwork and just following it. And it works every time. And they might not have symptoms. Like you didn't have symptoms all the time, but that once in a while, maybe like 5 minutes a day becomes 10 minutes a day, then an hour a day, and then becomes every single day. And then you just get used to it. You're like, oh, whatever, I'll take a Motrin, I'll take an Advil, whatever, for it. And I just learned to live with it. But why are you living with it? The body should heal. That sign of one thing off should be a light bulb. I need to get checked out.
Right. Yeah, I totally agree. And I think, there's, the pandemic probably did all of us a big favor, and it sort of woke people up to wellness and becoming a citizen scientist, taking a lot of these choices into our own hands. And I think if nothing else, if you find a biologic dentist, I mean, there's no harm in going in, making an appointment and getting a cone beam x-ray, if that's what they use. Yeah. And just seeing for certainty, because I'm not sure that some of these full body scans, like a Pronovo,
They won't
clearly
show
as all
it.
the heart.
Yeah,
but
they won't show it. Even
won't show that.
clearly, no. It's you need a dental 3D CT because I've gotten those quite a bit. Your daughter.
Yeah.
It's like, hey, what's going on with this person?
Yeah.
Like, I kind of see a little bit here, but need definitely a dental 3D scan or a CT scan.
But the Pronova will kind of wake you up and say, there might be a pathology here, and then you can go in and zero in on it.
Yeah. But like going back to the cardiac issues, like the plaque, right? If they had the wisdom teeth, we know according to meridian chart are connected to the heart, right? All 4 chambers of the heart. Now, if you have elevated, what we talked about before with cytokines, this is RANTES or CCL5. If it's elevated, that can cause plaque vessels, like plaque in the vessels. Now, but the Pronova scan might not show it yet, but in the future, it's developing, right? So if there's an issue here in the jawbone, we should address that prior to the plaque showing up.
Right.
Let me tell you about something that's been a total game changer for my sleep and my stress levels. Bioptimizer's Magnesium Breakthrough. Here's the thing most people don't know. Regular magnesium supplements only give you 1 or 2 forms, but your body actually needs 7 different forms to function properly. That's why you might be taking magnesium and still feel tired or stressed or having trouble sleeping. Magnesium Breakthrough is the only supplement that combines all 7 bioavailable forms in just a single capsule. Within just a few days, I noticed I was falling asleep faster, staying asleep longer, and waking up actually more refreshed. Plus, my post-workout muscle recovery has been incredible. If you're ready to finally get the deep restorative sleep you deserve and feel more relaxed during the day, head to bioptimizers.com and use the code ULTIMATE to save on Magnesium Breakthrough. Trust me, your body will thank you. Now let's get back to the Ultimate Human podcast.
So what do you feel are, like, what are the outcomes, some of the outcomes you're seeing? Like, are you still surprised, even though you're doing this every day, by some of the stories you're getting from people that you remove those teeth, you clean everything out, and then they come back to see you, let's say they get the implant in. What are they saying? Like
every day it's goosebumps. Every day
Really?
Something else, yeah.
You send me some of them.
Yeah, it's just surprised. Like yesterday I did a surgery, about 6 hours long. Insane surgery. And today I saw him for his follow-up. I'm like, how you doing? He's like, I feel totally different. Like, I mean, literally, you got beat up. Like,
That's serious.
He had severe infections in his jawbone. And I recorded some of the videos so I could send him clips of it. But he's like, I feel different today. Yeah, he's swollen a little bit, but he's like, I just feel different. And one of the things I've noticed on every patient who goes through this treatment, cleaning up their jawbone, taking out the stuff that shouldn't be there, their eyes lighten up. There are patients and these patients are asleep, so the next day I see them, their eyes just are totally different.
Really?
Yeah, it just clears it up. There's just something about it. I mean, it makes sense. All the pathogens are here, right? Your eyes, and they clear up. But the ones who are awake when I do the procedure, when I get that last little speck out of there, cleaned up, you can just feel the energy. It happened on you too. It happens on everybody, Max, everybody, right?
Yeah.
As soon as I get that speck out, it's the blood's flowing. Like, hey, how you doing? And all of a sudden,
Hey, how you doing?
It's totally different. They feel it, right? Because it just opens up. It's like brain fog gone, psychosis gone. It's insane. Like joint pain gone, shoulder pain, neck pain, you name it. It just, there could be other stuff there, but they're starting to feel the difference there.
It makes a lot of sense to me because, along the lines of this immunofatigue, a lot of the viruses, some that you just named, people think that they catch these viruses, but very often you don't catch them. These are not things that are happening to you. They're things that are happening within you, right? Because there are things that you've always had that are becoming recurrent. So like if you had mono in 8th grade, let's say, it comes back as Epstein-Barr as an adult. If you had chicken pox, it comes back as shingles. If you have the JV virus, it can lead to infections in the brain. So these are viruses that are already woven into our DNA. And the immune system doesn't have a problem silencing these. Every time a cell divides and replicates, these viruses are silenced. But when you have a chronic low-grade infection, I think the important thing to understand is, yes, our immune system is good at managing these things, but only for a period of time.
Yes.
Right? It's like, even the greatest fighters rest. They don't just stay in the ring and fight. And if the immune system is in this low-grade fight constantly, it gets exhausted, the immune system runs down, and this is what triggers these viral pathogens. And so, you're not saying, the root canal caused the Epstein-Barr, but the root canal caused the infection, which ran down the immune system, which allowed for this EBV infection or a cytomegalovirus infection, or it allowed a Lyme infection to become recurrent, or shingles, or any number of things. It makes perfect sense because you are depleting the police force that's there to protect you. And are there specific markers when you're looking at the blood of patients that have these infections? What kind of markers would they see? It's not going to be on typical blood work.
Correct.
I mean, maybe C-reactive protein, but what kind of markers would you see on a panel, or would you pull to see if maybe a chronic infection might be the underlying issue?
So the problem is, majority of the time, it shows nothing. Right? You can pull the interleukin 1, interleukin 6, TNF-alpha, RANTES, or CCL5, and it's going to show nothing. But you have these hidden chronic infections. The problem is the body has walled it off. The jaw, not the body. The jawbone has walled this infection off, basically encapsulated it, right? So the blood can't get to it, and it's just a swamp inside. So that's the biggest problem. That's one of the reasons why it goes undiagnosed or hidden for years. So trying to get the blood work and saying, okay, well, where's this coming from? It's not one of those things that we do routinely, because knowing that, hey, there's a chronic issue inside here, let's clean it up, and then let's see what happens. And once it's cleaned up, everything goes perfect for them.
What would you say are the most common 3, 4, 5 symptoms that you see? Having treated so many patients, when they get in the chair, is it headaches? Is it neurological issues? Is it brain fog? What are some of the unresolved things that you hear over and over again?
So brain fog, IBS or gut issues,
irritable bowel syndrome,
fatigue, joint issues,
fibromyalgia.
Well, that's part of it, right?
I feel like fibromyalgia and chronic fatigue are these just big casting nets that don't really mean anything. Well, they do. I mean, they give you a name for the symptoms you're having, but I don't feel like when you're told you have chronic fatigue or fibromyalgia that it's a thing that you can treat.
Correct.
So you hear that pretty.
Yeah. And autoimmune. Yeah. It's an autoimmune so vast.
Yeah.
Same thing like fibromyalgia is vast, right?
Yeah.
Joint pain, so vast. And it's because something is off. Their immune system, like you just said, it's constantly fight or flight, constantly sympathetic overdrive, and it doesn't know what to do. And then the trigeminal nerve is linked to the vagus nerve. They're connected. So now if someone can't get into parasympathetic, how are they supposed to digest their food? How are they supposed to do that? You can give them all the supplements you want in the world. They're like, it's not working.
Right. Because they're stuck in this fight or flight state.
Yep.
It's interesting. I was preparing for a talk not too long ago, and I was just looking up stats on autoimmune disease. And depending on the autoimmune disease, it ranges between 80 and 90+% of all autoimmune disease is idiopathic, meaning of unknown origin. So somewhere between 80 and 90, and sometimes more than 90% of the time, I don't remember the exact statistics for each one, but my jaw hit the floor. When you're told that you have an autoimmune disease, Hashimoto's, Sjogren's, lupus, Crohn's, when you're told that you have this autoimmune disease, it's of unknown origin. They go, well, we don't really know why you had it. Oh, well, your aunt on your mom's side had it, and your uncle on your father's side had it. So it's probably familial, even though there's no gene that would be linked to that autoimmune disease. And if that vast percentage of autoimmune disease, where you're led to believe, okay, you woke up one morning and your immune system decided to just randomly attack the colon. So now you have Crohn's. It decided to randomly attack the thyroid. So you have Hashimoto's. It randomly attacked the lacrimal gland in your eye. You have Sjogren's. It's hard to subscribe to that. Like, I woke up one day and my immune system just went haywire. Very likely, you woke up one day and the immune system couldn't keep whatever it was at bay any longer. And the sad thing about most people that are diagnosed with an autoimmune disease is that's when the search stops, because they say, you have Hashimoto's, so you need levothyroxine, Synthroid, armorthyroid for the rest of your life. And the patient goes, okay, I have this disease, probably got it from my ancestor, and the search stops.
Yeah.
But that's kind of where the search should begin, in my opinion, because I don't believe anything, and I don't have all the answers, but I just don't believe that anything in the human body is idiopathic.
Yeah.
I don't think anything is of an unknown origin. I believe that we not know what it is, but a diagnosis should not be out of thin air of unknown origin. That should start the search, not end the search.
Yeah.
You know what I mean?
You know, I agree. I just recently met a doctor in St. Louis, and he said something very special to me. He's like, I treat the symptom, not the diagnosis. It's like, that's very interesting because we're so into diagnosis, ICD-9 codes or ADA codes. Like, hey, this is the dental code, this is the medical code, that everyone needs a diagnosis. No, let's go back, take a step back. Look at the symptoms. What are the symptoms? How are we going to challenge the body to fix itself? So if we get rid of whatever's blockage, the body can heal. And that's what I love about the human body. And that's why I got along with them so well, because like we're both in the same field. Like you're a medical doctor, I'm a dentist. This is what we want, because the human body can heal, and it heals really well. Like it's God's given gift, somehow created us to heal.
Yes.
But we have these obstacles and roadblocks in the way.
Yeah.
And then you're labeled like, oh, you have a diagnosis. Here's Hashimoto's or here's lupus, and then just deal with it. But then how do you deal with it? You get a pill, but if you can't digest, then how's it going to work? Like it's like, let's go back to the basics. And that's the fun part about biological dentistry. It's like, I love playing detective work with the patients. Like, okay, well, when was this first thing done for you? Okay, let's go back in time and did something happen? Did something change for you? Teenagers all the time, they're like, we call it freshman 15 or 20, whatever it's called now. They're like, yeah, I started to gain weight and I started having gut issues. But what did you have a few months prior? Oh, yeah, I just saw the dentist. I got my wisdom teeth taken out right before I go to college. Okay, well, that's the only thing you had done? Anything else? They're like, no. Okay, so maybe we should just take a look there. And that's our starting point. Because if your life changed from that starting point, let's go back to it. And let's see what we can do and how to make a difference for you.
Yeah.
All right.
Yeah, and I think that, this is opening up a whole field. Have you seen, and I'm not asking you to make a medical claim by any means, but have you observed patients that had autoimmune conditions of any kind go into remission, or have you seen their antibodies turn off to the point where we would say, okay, that condition is now in remission?
Yeah, I have a patient who allowed me to share her testimonial, Tasha. Yeah.
Really?
Yeah. Her autoimmune is gone. I've seen bar virus gone.
Really?
Yeah.
Where can I see that testimonial?
Right here. Yeah.
Oh, right here.
I could post it. Yeah. She
It's
gave
on
me
my phone.
She gave me a whole testimonial to like.
Oh, she did?
Yeah.
All right, so I'll throw in the show notes.
Yeah.
Okay, that's great.
We'll put it
Thank
in
you,
the show
Natasha.
notes. Yeah. So
What autoimmune did she have?
Epstein-Barr virus and something. I don't know the specifics about it, but she went into the whole detail. Yeah.
Wow.
But then she had joint pain and completely gone. Everything's
gosh.
gone. Yeah.
So many people with diffuse joint pain.
Yeah.
And do you think that that's because the immune system is distracted, or do you think that these bugs are migrating to low blood flow areas of the body, like joints, tendons, ligaments, cartilage surfaces, things like that, where they can retreat? Lyme disease, for example, is infamous for hiding in what's called the dorsal root ganglion. So retreating to this area of really limited blood flow. It's like running into a dark alley so the authorities can't really see you. I mean, viruses are great at doing that.
I think it's both, actually, because there's also the parasites there, right? But the two parts I would say to that is, one, that it's inhibiting the blood flow or the electric. Because if we look at the meridian charts or the meridian pathways, it's energy flow. So and the human body's high-powered electricity. So if electricity wire's cut, it can't flow anymore. Right. But if you look at high-powered lines, like an electrical plant, electricity can jump, and that's how the human body is. So it tries to make it up, and it's like, I'm going to keep on going and going until I can't anymore. So when the flow is stopped, that's when the disease starts. So that's part of it. Another part, it's definitely hiding on the nerve itself, because when I clean up the jawbone, especially in the wisdom teeth area, I could see the inferior alveolar nerve, which is what we call the IAN nerve. That gives us innervation sensory to our lower jaw. And literally yesterday I was cleaning out, I could see the whole strand there, but I'm cleaning all the pathogens off of it. And in an x-ray, you just see a black area and a white circle. So you know that's the nerve. Like, okay, but how deep and how infected it is, you don't know until you get in there. Right? And when you get in there, I'm like, oh, whoa, that's his whole nerve there. and I'm cleaning those. So now imagine all those pathogens, just not viruses, but parasites, mold, or fungus, and bacteria. They're making their way back up into the brain, right? Because they love that nerve. They love its retrograde axonal transport, right? So they want to go backwards. And now from there, now they got access to the rest of the body because they're going to communicate with each other and then make themselves wherever they want to go hide. And then that's where the joint pain or disease or organ stuff.
And I think it's important to point out that's why it's not linked to just one thing, right? I mean, that's why it can manifest itself in so many different ways. You know, I talked about this with this condition, diffuse vasculitis or dystonia vasculitis, where there's certain thing, I won't say what that thing is, you can probably read between the lines, which causes proliferation of spike protein and causes the lining of the vessel to be irritated and inflamed. And when you inflame that much surface area in the body, which is about 6 tennis courts versus the surface area of the skin, which is about half a tennis court. And I'm talking about the lining of the blood vessel. So you get an inflammatory condition, diffuse vasculitis, dystonia vasculitis in this part of the body. You've interrupted the most important blood-brain exchange in a human being because now nutrients and raw materials, vitamins, minerals, amino acids, what have you, that are in the blood cannot exit into the tissue, and waste from the tissue, and I don't mean stool or urine, I mean cellular waste, can't exit the tissue and get back into the blood. And so the myriad of symptoms that come from this is not just singular. And that's why people have a hard time accepting that this one hub can lead to all of these spokes.
Correct.
And I feel like biologic dentistry is like this. You know, this one infection in the jaw, whether it's parasitic, viral, bacterial, or combination, or fungal, or mold or mycotoxin, this infection can manifest itself like this, like this, like this. I mean, it goes from noon all the way back around to noon.
Yes.
And I think when something has that diffuse of a myriad of symptoms, it's hard to say it's that. And that's why I think it's so important to just bring awareness to this, because it may be as simple as you finding a biologic dentist in this registry that you're going to share with us, and going in, making an appointment and saying, let's get our teeth clean and let's just do this cone beam x-ray just for peace of mind. It's like going in and getting a Pronovo scan or a full body MRI, and do this, just for peace of mind.
Yeah, like one of the patients you shared, and she also said I could say her name, Amelia, she came up and Sage talked to her for a while, and she was like, on the fence of what was going on. So she came up and she's like, yeah, I have trouble lifting my kid. And that was touching because it's a newborn and she can't lift her child. And I was like, okay. And then she's just telling me she has symptoms with IBS and chronic joint age. Like, okay, we did the surgery. Next day, she's lifting her little kid. I'm like, what's going on? Like, my pain's gone. I'm like, there's no way.
She told me about that.
I'm like, there's no way.
She told me about that.
And that's why I'm stunned. It gives me goosebumps every time. Yeah. The next day, I'm like, wow.
Now her big boss is in to see it too.
Yeah. And her IBS is gone. She's like, I don't want to share, TMI, but she's like completely gone. She always had trouble.
Yeah.
And I was like, okay. And that just confirms, because I do all the studying. It takes like 7,500 hours to graduate dental school in 4 years, just education. I mean, I've studied over 25,000 hours after that because just me and you, like how we geek out. And when I see something, it's like, go down that rabbit hole, love reading.
Oh, no, you're always sending me slides from lectures. And I'm like, half of these I would love to go to.
Yeah, and it's interesting because it's like I fly around the world to go learn, because it's like, this is just, wait, you just did that and that person healed? What am I doing wrong? Or how did I mess up on somebody? Because it's a Hippocratic oath. It's an ethical duty of mine. It's like, I can't do something wrong. And if I did something wrong, I need to reverse it. Yeah. And it's just, it goes all around. And that's the thing. It's hard to pinpoint one symptom or one issue.
But what's really exciting about that is I often try to make the argument that usually multiple things in the human body don't fail at the same time. They don't, like, you don't wake up with a mental illness, an autoimmune disease, irritable bowel syndrome, chronic infection, a viral pathogen, parasite, paresthesias, all of these things. Usually what happens is one thing goes wrong that causes everything, instead of multiple things failing at the same time. And we rarely go back and look at what was the first domino to fall. And we're so far down the line of dominoes that we're going, well, you don't think, like I just had a client, and I am not a physician and not licensed to practice medicine. I was there with a licensed physician. What was really interesting is he had a pretty severe neurological condition, which they thought was Parkinson's. He didn't respond to the Parkinson's treatment. And it's getting progressively work. And then we're looking through the blood work, and there are all these specific interleukins. So all of these cytokines secreted from white blood cells. And if you actually map the different interleukins, it will kind of tell you what that white blood cell was in the presence of, right? It'll secrete a certain interleukin for one kind of enemy, and it'll secrete a different interleukin for another kind of enemy. And so I was looking at all these interleukins. I go, what's really interesting is each of these interleukins are cytokine secretions for the presence of a virus. So this definitely looks viral. Then we looked at the urine test, and it was like, wow, they have a Borrelia bacteria, which is a Lyme co-infection, bacteria in their urine, really high levels of this Lyme co-infection bacteria. And then we start to back up the clock, and lo and behold, I talked to him, and he's like, yeah, I had Lyme disease in 2018. And my head went, oof. And I was like, how did the neurologist miss this? Because that's not something that should be discarded.
Correct.
So what happened was this infection happened. They thought it was fixed. It stayed low grade. And then the dominoes started to fall. Autoimmune, neural inflammatory conditions, showing up as a neurological disorder, then showing up in the prefrontal cortex, and then affecting memory, and then mood, and then emotion. And so by the time you get as far down the road as we were, you're not really thinking of how do we go all the way back to the beginning and see if we can find that first domino. Let's just start standing these things up in reverse.
Correct.
And I feel like for a lot of people, these oral cavitations are that domino.
Yeah.
Because it's especially frustrating for people like me that I would consider to be, taking fairly good care of themselves, right? I certainly don't profess to be Mother Teresa, but I'm conscious of the food that I'm eating.
Yeah.
I'm conscious of my sleep. I'm conscious of my air and my water, and there are a lot of people like that. We exercise regularly, get sunlight, all the things. And yet there's something that's just off that you can't put a finger on.
Yeah.
And maybe this is that domino for them.
Hi guys, Gary here. I want to take a few minutes of your time to invite you to my Ultimate Human VIP community. This is a private community with front row seats to my most advanced health protocols, exclusive monthly Q&A calls, a private podcast where you can ask my guests and me your most pressing questions, and my own personal wellness blueprints, and everything you need to optimize your health. You'll connect with like-minded folks in this community. You'll get firsthand access to cutting-edge insights and enjoy special discounts on products that I trust the most. And here's the best part. Membership is just $97 a month, a fraction of the cost my private clients pay for the same deep dive guidance. If you're ready to supercharge your wellness and skip the guesswork, I'd love for you to join us. Head to theultimatehuman.com/VIP. That's theultimatehuman.com/VIP right now to become one of my Ultimate Human VIPs. This is your fast pass to better health, so don't miss it. Now let's get back to the Ultimate Human podcast.
No, and I agree 100% with you, because we see patients who are athletic, but they gained a little bit of weight, then they lost weight, right? And then all of a sudden, they're on this diet, and they're like, I just got sick. Was it the diet that made me sick, or was it what I have inside my mouth? Then you have patients who are overweight, obese. They're like, everything's fine on them. Their mouths are a complete mess because their bodies of visceral fat can secure the toxins. Right? Visceral fat, abdominal fat holds onto toxins, right? Then they start to lose weight, and they're like, I just got sick. I should just gain the weight back. No, it's you lost the whole thing started years ago when you had all this done. You gained the weight. There's a reason why you gained the weight, not just because of poor lifestyle. It's because you couldn't digest the food properly because you went into sympathetic overdrive, but your body was handling it. And then you decided, hey, I want to get healthy again. I want to lose all this weight, which is great. Then you got sick.
Yeah.
So they're like, damn, what did I do wrong? Oh,
Right.
I should have just been overweight.
Yeah.
That's a complete
exactly.
wrong thing to do.
Yeah.
We got to go back to that starting point. And that's the fun part. That's the part where the patient has to be their own advocate, do a timeline. And that just helps us all out. It helps you out because you overlook a lot of people's care underneath the medical team, right?
Yeah.
And it just helps get to that, okay, well, now that's where it started. Let's go look at that. And then if we get to that starting point, and everything just arises.
Yeah, totally agree. So I think we've hammered home the need for people to get this checked out. I often talk about my morning routine, my sleep routine, and part of my morning routine, and I want to get your opinion on this, is, taking our oral care routine from just being the bare minimum, which is just brush your teeth, to what I would call like platinum oral care routine. So how important, in your opinion, is it to add tongue scraping, flossing, things like oil pulling? Are you a fan of those? Because like my oral routine is I use a hydroxyapatite toothpaste. I'm not a huge fan of using the high fluoride toothpaste. Floss at night, swish. I tongue scrape at night and in the morning with a copper tongue scraper, because remember, the copper is not the important thing. It's just that it doesn't harbor the bacteria.
100%, yeah.
And a lot of these are plastic or they're, aluminum. They just don't have the same capacity to be bactericidal as copper. And those things are dirt cheap. I mean, I think you can get them for $5-6 on Amazon. But it is astounding how much better I feel when I just add those few little things. Just the tongue scraping. I keep a little dish of organic extra virgin olive oil, and I'll just take half a tablespoon of it, and I'll swish as long as I can. I never do 12 or 15 minutes like the thing said. It's like, dude, your mouth gets exhausted. You're
30
like,
seconds
oh my
feels
God.
like 10 minutes.
My ADHD kicks in. I'm like, screw this, dude. This is an absolute pain in the ass. Amazing how much better I feel. And my gums used to be really sensitive. They're not sensitive at all now. My teeth are not sensitive at all. So how important is that oral care routine, and where would you say each of those things falls on the spectrum?
So tongue scraping, 100% super important. Mouthwash, I would get rid of.
Yeah, I don't
Pour
do
it out
mouthwash.
because the biggest thing is some of them are floor cleaners or antiseptics, whatever you're using. Biggest problem with mouth washes, you're wiping out the good bacteria plus the bad bacteria, but then you're also low in nitric oxide, right? Because it starts from the back of the tongue. So then people are low in nitric oxide, low in energy. So just get rid of that. Coconut oil pulling, virgin olive oil pulling, 100% important. Try at least 5 minutes.
Okay.
We do recommend 10 minutes, but at least get 5 minutes.
3 to 5, I think I can do. Yeah.
So and then don't spit it down in the bathtub. Put it in like. Someone's gonna slip after you.
Yeah, don't spit in the. I don't know if you shouldn't be spitting in your bathtub anyway. I mean, that's a whole different discussion. But I spit it into the garbage can because I'm afraid that it will like cool off and coagulate again. In my,
There'll be a problem.
My thing.
With toothpaste, that's the biggest thing. I use a tooth powder because anytime a paste is formed, there might be a chemical in there. So I use a tooth powder.
Okay.
It has beta-alanine clay in it. Has cinnamon in it. Has hydroxyapatite in it, like particle form. So I like using that.
Yeah, I've used the dry chewable tablets too.
Yep.
I've used those before too. I forget what the brand was. If I find it, I'll link it in the show notes. No, I don't have affiliation with any of those, but that's made a huge difference. Flossing and oil pulling's made a huge difference. Man, if you just want your mouth to feel good,
correct.
Brush, tongue scrape, floss really well, and then oil pull either with something really thin like a coconut oil. I mean a extra virgin olive oil, or I take the whole coconut oil thing and pull it in there. Man, when you spit that out, when you're done, I don't know, something feels like just healthy and alive in there, and it adds 2 or 3 minutes to your oral care routine, and $5 to your budget.
Well, the floss is super important, right? So you got to make sure it doesn't have PFAs. All those forever chemicals in there because a lot of the floss is not good. It has plastics. Now you got microplastic toxicity going into your gums. Remember, those blood vessels, the gums are alive, right? Now
so what are some good floss to use?
So no affiliation.
Yep.
Cocoa floss is one of them.
Cocoa?
Yeah, and then David's has one, which are PFA clean and everything clean. But a water pick, a simple water pick.
Yeah, water pick's
Yeah,
good too.
that will do the trick, right? It'll get the food out in between the teeth. Naturally, like flossing's super important because we're told flossing's important, but remember the teeth can remineralize. If you have the right diet and taking good care of yourself, the teeth are going to remineralize. It's hard for food. If food's getting stuck between your teeth, there's a problem there. Right? Either you have recession, periodontal disease. It's to get over to the dentist and figure out why you're getting food stuck between the teeth.
Right.
Majority of the time, food should not. There's spillways. It should just wash right between. Right.
But it's amazing how many times I swish at night and I'll see like a little particle come out.
Yeah.
And I'm just happy that I did it. Well, what else does my audience need to know about biologic dentistry, why they should seek, consult with a biologic dentist, or what symptom might they be having right now that they can't put a finger on where your antenna goes up and says, you should come see somebody like me?
That's exactly why they should see a biological dentist. Because that's exactly why. Because they cannot. No, what you said last. Because no one could figure out what's going on. And one of the biggest problems with that is I'm like the 30th person they see. They've been around everywhere. They spent so much money on their healthcare.
They're so skeptical by the time they come to you.
Yeah, and then they're like, okay, fine, I'll just do it. And then they're like, I should have started here. I'm like, yeah. Unfortunately, like dentists, we're the tail. We should be the head. We should be teeth are in the head, right? We should be the first one to go see. It's important to see everybody, but we should be up at the top priority. But if they have something that no one could figure out, definitely go see a biological dentist.
Amazing.
But the other thing is preventative care. Right? Why wait for something to go wrong? Just get the scan done. Go to the right biological dentist. We'll put a link there. I'll get you the link. So this way, get checked out. And if something's there, you don't need to go after it right away if you don't want to. But at least now you know, and you can plan.
Right.
Right. And the major thing in biological dentistry is the ones that we're trained. We look for any metals, anything that's titanium, anything mercury or whatever you want to, the silver fillings, whatever you want to call it these days, because there's so much there's so much bureaucracy behind it. The metal crowns or gold crowns. Gold crowns are called the gold standard, but it's actually causing galvanic shock. It's causing low-grade electrocution. Yeah. It's like touching a 9-volt battery. Like, go touch it all day long.
Yeah,
right?
you've
Why
actually
do you want to do
shown me some of the images when you take these teeth off and they've got those metal.
Yeah, it's all
posts.
black underneath.
It's all black underneath because it's just been a low-voltage battery.
Yeah, and now how do you save that tooth? That tooth is dead. It's been dead for a long time. Like form and function was okay. That's traditional dentistry. But biological dentistry is going past form and function, right? So we want to see what else is going on with that tooth, right? The next thing is if you have a dead tooth or root canal treated tooth, if there's something, a dead tooth meaning it was injured, you got into an accident, whatever, it might be discolored, get that checked out. There could be a low-grade infection underneath there that's hidden. Yeah. And then if you had a tooth taken out and if it wasn't taken out with the biological dentist, just get it checked out to see if there's something there. Yeah. Right. The bite is, of course, is important. And then the oral gut connection. That's huge because everything's metabolic. Like if the gut's not working, how's your body going to ever process anything? Right. So those are the 5 major things. The first 3 things are always like the routine. The other 2, we want to make sure. And not everyone needs perfect bite. We all want one perfect bite, like the teeth to occlude each other. But as long as it's adequate, we're okay because there's a lot of other things to do majority of the time.
Right. So for my audience that didn't see the first podcast and doesn't know who you are, how do they find you? How do they find out more about you? Where can they locate you?
Yeah, so they can go to toothandbody.com.
Toothandbody?
Yeah, .com. And then there's a interactive meridian chart that we talked about and we stressed on this podcast. And there's a link there. They can put an inquiry and then we'll get back to them.
Okay, super.
Yeah, absolutely.
And the final question, because you answered it last time, it's coming. What does it mean to you to be an ultimate human?
So, things have changed, right? Because last time we did it,
he's going to say to be filthy rich.
No. Money's a byproduct of everything, right? So it's just, it's optimal healthcare, right? We all want to be healthy. And the thing is, there's so many blocks. There's so much information coming at us like, oh, do this, or do this, do that, right? It's breaking it down and learning how to be the best person I could be. And what's changed a lot is my spirit. This is something that's become more spiritual. And the energy flow. And it's just wild how it tracks. So Yeah, man. It's just
Yeah,
it's
yeah,
fun,
that's
dude.
so good.
It's fun.
Yeah, you're
man.
singing my tune, man.
Yeah.
I am a big believer in the power of prayer, which is essentially the law of attraction and the law of abundance and frequency and, tying into the quantum, because there is a lot more that we don't understand and that we can't yet specifically
I
explain.
agree. There is science that explains what we don't understand, but we won't understand it because it's too far out there.
Yeah.
Right. And there are machines out there, gadgets that measure the meridians, the electrical voltage, right? But it's just phenomenal. And when you connect with those people, it's like we were supposed to be in the room together. Somehow we took a flight coming from Germany, someone's coming from Switzerland, someone's coming from Mexico. We were just supposed to be in that room together.
Yeah, it's wild. I totally agree with you. Totally off topic. But Sage and I just recently went to the pyramids in Egypt. And, a lot of people talk about like this feeling when you're there, this sort of just presence of some, kind of force or spirit. And when you're standing there and you're looking at these 72-ton rocks, okay, solid pieces of granite that weigh 72 tons apiece, and you see them stacked hundreds of feet high, and we're applying all these modern engineering, theories on how it happened, and you see that from one corner of the pyramid to the other corner of the pyramid, it's only sank 8 millimeters. 8 millimeters. Now, I used to live in a building in Miami called the Porsche Tower.
Yeah.
And it's
I
in Sunny
remember the
House.
building.
Yeah, the
Yeah,
round one that
yeah,
had the car elevator in it.
yeah.
And I read an article like 5 weeks ago, and if you live in the Porsche Tower, no, it's not going to fall into the ocean. But I read an article that they went up and did an engineering survey, and the building had sank on one side 3.7 inches.
Oh, wow.
I'm like, okay, that thing was built in 2018.
Yeah.
And it has sank 3.5 inches, 3.7 inches. The pyramids have been there for 5,000 years.
Yeah.
And there's a difference of 8 millimeters from one side to the other. I mean, it's such a low grade slope that you can pour water on one side, it won't run to the other. It's just fascinating to me. And I'm not down the alien rabbit hole. I'm not, I'm not saying anything supernatural, but you realize that there is a lot that we don't understand. I think that, our society went one way and with our understanding of combustion engines and pulleys and levers and traditional science, but there's a whole other science, that I think is now becoming more mainstream about spirituality. And by spirituality, I don't necessarily mean religion, but spirituality, our connection to each other, purpose, commitment, the effect that emotional states have on our health, gratitude versus vengeance. So I think you're right.
Yeah, I agree 100%. This, like, since we've known each other, this has been a spiritual journey for me.
Yeah.
It's not religious. It's just something about energy and something of how the human body just starts to work. And I don't know why I was put in this position. It's just, I was not even a major, like, in science or dentistry going into college. I thought I was going to be a finance guy, a Wall Street guy. That's what I went into school for. My mom was a dentist, so it was just something that I was like, oh, I'll just do it. It's like, whatever. I'll just take science classes. I'll be a dentist. And then once I took those courses, I just like nonstop and just was like, now I got to be on the top of my
you're
game.
just so passionate and driven about it. Like you and I really do geek out and like legit. He'll be sitting in these lectures somewhere around the world. And he starts taking pictures of the screens and the slides. He's like, oh my God, look at this with vitamin D3 and this pathway of vitamin C. And I'm like, dude, why didn't you tell me? I would have gone there to that. Like I want to go to the peptide conferences. I want to go to the dental conferences. I'm so fascinated by it. And it's just amazing to have pioneers like you, Dr. Gandhi, out there fighting for the truth, staying ahead of the curve, not stopping your learning curve when you got out of school, reading your peer-reviewed journals, going to lectures, trying to further educate yourself. I think, there's something in the Hippocratic Oath about intellectual curiosity. And I think it was Hippocrates that said, I'm paraphrasing it and bastardizing it, but something along the lines that, when a physician in the practice of medicine loses their intellectual curiosity, they really lose the capacity to give care. And you've definitely got that intellectual curiosity. So
thank you, man.
So we're going to head on over into my VIP room because I leaked it out on X and I leaked it to my VIPs that you were coming on and they have a whole bunch of questions for you. So if you're interested in becoming one of the Ultimate Human VIPs, It's $97 a month, guys. Just go over to theultimatehuman.com/VIP, and you can sign up to be one of my VIPs. We'll open up live Q&As. You'll get private podcasts. You'll always get special hours with me after the challenges. You can ask any question that you like. I hope that I see you in the VIP room. And until next time, that's just science.